Each year, the CCS Global Benefits Team strives to provide the best benefits for the eligible employees of its affiliated companies at the lowest cost. This year, during open enrollment, this presentation will review the results of the negotiations this year for the new plan year beginning January 1, 2024. During open enrollment, it's a time for you to make changes to the benefit elections you currently have, depending on what lifestyle changes or stages in life you're in. Some changes might be necessary. A brief overview of the benefits might be helpful so that you can be reminded what's available to you and what the details of these plans entail. I'm happy to report that the carriers providing coverage will remain unchanged. It's important to maintain stability with benefits programs so that changes don't have to be made in providers, care, or prescriptions that you might be on currently. So MetLife will continue to provide life insurance, dental, vision, and disability plans, as well as a couple of complementary worksite marketing products for critical illness and accident plan coverage. Blue Cross Blue Shield of Arizona, using the entire nationwide Blue Cross network, will provide 4 medical plan options for which employees will choose. And while there are some differences in the out-of-pocket maximums, these plans are essentially matching the current plans that are available. Triada offers a gap plan. Somewhat different benefits for high-deductible health plan participants than PPOs, but 2 plans that will match up with the medical plan you select and help with the deductible in certain circumstances. The E-System will continue to be used for enrollment and access to your benefits summaries and some documents throughout the year. Please remember that these plans meet the minimum essential guidelines of the Affordable Care Act, which means that employees eligible for this plan receive enough subsidy that you're not eligible in the marketplace for a subsidy. Due to the change in the family glitch that was part of that law and something that needed to be corrected, families can now gain subsidies through the marketplace if desired. The plan's anniversary is January 1. Open enrollment will be conducted about this time each year. Remember that your premiums are taken on a pre-tax basis for medical, dental, and vision, which saves a little bit of the high cost of health care for you when you're doing these payments through your paycheck. The medical, dental, and vision are also COBRA eligible plans, which means they can be continued if your employment should end at your employer. The first product paid for by your employer is life insurance. Each and every eligible employee on your original effective date is provided with $20,000 worth of group term life insurance. These plans don't cost anything, but you need to make sure that you have an updated beneficiary in the E-System so that that benefit, if necessary, will be paid out to the proper person. If you'd like to add additional life insurance and didn't take advantage of some of the guaranteed amounts to you when you were brand new in this program, you can enter the voluntary life program. And if you don't want to answer any health questions, you just get in at one of the increments at $10,000 for yourself. And then you can take coverage on your spouse and child as well. Health questions apply for amounts that greater than that, even during open enrollment, if you can't pass a health questionnaire. But if you want a larger amount, simply fill out a self-reported health questionnaire statement or statement of health. No physician or doctor's office visit or medical exam is required. You just self-report that, and if you're in reasonably good health, it's likely that you'll be approved for an amount up to the maximum. That is $500,000 or 5 times your annual salary for you. And remember, if you join it, you can take it for a spouse and your children. All children benefits are guarantee issue. Deductions for voluntary life, by the way, are post-tax, so you don't have to pay taxes on the benefits if they're paid. The dental plans are pretty straightforward. You got a low-cost plan and a higher-cost plan, just varying the benefits so that you have a plan that's appropriate for your needs. If you don't use dental plans very much and just need to get your teeth cleaned, the low plan's probably fine. It has a $1,500 maximum, but it provides preventative exams twice a year at no cost as long as you're using MetLife Dentist. That plan has a lower percentage for basic services, which is cavities being filled, and a little bit lower on major compared to the high plan. But both plans provide that preventative service exactly the same way. They both have orthodontic benefits for children up to 26, just a lot less on the, or half as much on the low plan, and $1,000 on the high plan, as you can see. Benefit maximums are amount they pay per member for how many people you have insured if you have dental expenses that are covered and incurred by a MetLife or with a MetLife dentist. So just pick the plan that's more appropriate for you, or certainly Waiving this benefit if it's not necessary for your family is certainly okay too. The Vision Plan, provided by MetLife, and please remember that you mentioned that it's a MetLife plan as opposed to mentioning that it's VSP. VSP system does not have your eligibility in there, and it's going to cause a little bit of a problem if you direct the physicians that way when you seek out services. So just remember it's MetLife. They'll check that with them, and everything should be fine. If it's not, you can call our office. But the plan's pretty straightforward. Annual exam, $10 copayment, and the exam's covered at 100%. If you need to have new corrective materials, glasses or contacts, you can pick one or the other. And if you pick glasses, you'll pay a $25 copayment. Your lenses, if they're not too fancy, are going to get paid 100%. Your frames have a $130 allowance. So if you want glasses that are more fancy and you want to pay over that, even though they'll discount some of the cost over the standard retail allowance, you will have to pay the difference over that $130. Contacts, a little bit higher copay, $39 instead of the $25. Still get the $130 allowance to purchase contacts, and each of these things are provided to you every 12 months. Looking up in-network providers for the the dental and the vision is pretty easy on the website, metlife.com. If you want to register there, it'll know what your benefits are and what your network is, and you won't have to remember that it's the PDP Plus network for dental or the VSP network for vision. But if you don't want to register, you simply go in there as a member not registered, and you can still pick the network that you're in, still search by zip code, and get the same exact list if you don't register. So not necessary, but certainly helps it be a lot easier especially when you're busy and on the road and don't have a lot of time to look these things up or remember what it is. The mobile app for MetLife just gets the access to the same information. You do get your ID card. You can search for providers there on the app, and it just makes it more convenient because if you get the app and put your member number in there, it'll know who you are and what plan you're in. So it does make it a little bit easier. App's available on either Google Play or the App Store for your convenience. 2 disability plans. Remember that the short-term plan, you're buying up that benefit from a basic $100 a week. So don't leave the selection there if you would like to cover closer to your 60% of your salary. And you can go up to that 60% in $100 increments until you get right there at 60%. So just be mindful. We've had people not just elect the coverage and not notice that it's set pretty low in the system. So just a hint for you as you're enrolling. Short-term plan covers you after 2 weeks. Hopefully you've got some PTO time or days that'll be paid in that time period, but the disability plan covers your income after you're out for a couple of weeks. As long as you're on your doctor's care and they say you need to be out longer than that from work for an illness or an injury caused disability, you'll be paid 60% up to $1,000 as long as you elect the maximum that you're allowed in the system. Pays for 90 days under the short-term plan. The long-term plan, which you can also elect to take, covers a longer, more permanent leave from work based on a health condition. And it's also including injuries or accidents or illnesses. And it picks up after 90 days just where the short-term plan leaves off. 60% to a little bit higher maximum per month. If your salary limits that benefit, it's just limiting it based on the 60% up to these weekly amounts or monthly amounts in the long-term disability case. So that long-term plan will go to age 65 or whatever is deemed your normal Social Security retirement age. For some folks, that's getting up to 66 or 67. So just be mindful. But it will pay you through that age when Social Security will actually pick up and pay you for a disability, the income protection you're getting from these plans. So if you do want to cover yourself in case something like this happens, you'll want to look at these plans and elect the benefit you want in the short term. The long term is automatically gets set at 60% of income. Supplemental worksite, both from MetLife and Triada, it's just worksite marketing. We picked these so they complement your major medical and they don't reduce by those amounts or affect your payments from the medical program. However, if you want an accident plan that covers you for accidents and pays a flat amount depending on what the accident or injury is, that's available in a high-low kind of a format. Pick one of those that you would like to have based on premium or what you'd like to be paid based on injuries. They also have a critical illness if this happens to be in your family history and helps you with out-of-pocket expenses that you would incur if you come down with critical illness listed in the policies, and we can certainly provide that outside this meeting. Triada is a way to fill the gap of your deductible. If you pick a higher deductible plan, for instance, you might want to buy this plan just to make sure that you've protected yourself against that high deductible in case something happens early. If you are in a hospital setting, these plans will help you. And it doesn't pay the first part of it for HSA or high deductible health plan people because the law doesn't allow them to do that. But under the PPO plan, if you like that, it'll pay up to $5,000 for deductibles. The medical plan options, like I mentioned, they're very close to what the options are today. I'll show you what those differences are in just a minute, but you still have three PPOs with copays, very similar looking, and the deductibles, of course, are the same. And then you've got the high deductible health plan. That's a qualified plan. The IRS deemed that qualified, so you can have a health savings account for tax-free savings that roll over every year if you don't use them. Remember that all these plans are very similar in the sense that they have the same network, same doctors and hospitals in all senses. They have the same features like they're open access. You don't have to go to primary care to get a referral to a specialist. They cover the same conditions, really, same medically necessary conditions and the same treatment plans. So you don't have a plan that doesn't cover something that another plan would. They're all the same for pharmacy formulary as well. They all require pre-certification for some surgeries, just like health insurance does these days. As long as you're in network, the doctors and providers will take care of the pre-certification for you. The only difference, therefore, in these plans is the cost sharing that you experience when you use the plan. And of course, the high deductible health plan has an HSA component, and only that fourth plan allows you to have the bank account. So let's take a look at the traditional PPO plans, the first three plans. They have co-payments in them. They're pretty standard, and what people are probably more used to as they purchase health insurance. They all three provide wellness at 100%, and that's required by law now. Just if you have questions about what's entailed in that and don't want to be sold up by the physicians, just make sure that it's a wellness exam and they bill it that way, and don't do testing that's not recommended by the American Medical Association. And we can help you with the list of services by age categories and gender as well. They have copays for office visit, as you can see. Emergency room for actually all three. Urgent care copays as well. When it has a copay, you're not going to pay additional amounts for that particular service. The deductible doesn't apply to those per se. They do accumulate to your out-of-pocket maximum. If you have a larger claim like a surgery or a hospital stay, a larger claim coming up, maybe like an MRI, nuclear testing, they're going to take the deductible out after they discount those claims. So you'll look at the deductible when they see a larger claim coming of the types that I just mentioned. Then they pay a percentage, and you pay the converse of that percentage to 100%. So 80% plan, you're going to pay 20. The 70% plan, you're going to pay 30% of the bill after the deductible is satisfied. Once you hit that max out of pocket, which again includes deductible and the co-payments, you're at 100% for the rest of that calendar year. All the services will be covered, assuming they're medically necessary, and you're in the network of providers. No limits on what they will pay in your lifetime. Those were removed. No exclusion of certain physicians. So they're very comprehensive major medical plans as required by federal law now. They are required to cover all medically necessary treatments for conditions that human beings come up with in their lifetime. The differences in the plans and the things that have been changed is the out-of-pocket maximums on the plans have gone up by about $1,000 on some of them. So we've got on the 6,000 it only went up $150, and on the PPO 4,000 it went up 1,000, I believe. And I think it went up 1,000 on the 1,500 as well. So we did that because it affects fewer people. You have to be using the plan to a higher degree to hit those kind of cost sharing marks. But we figured that would affect less people and probably share the cost a little bit more. And it did affect a lower increase from the carrier, in addition to just getting some concessions from them without having to change plan design. So pretty minimal as far as the plan design changes that are made, certainly compared to a couple years ago when we had to revamp almost completely. But those are the changes that you want to be mindful of. The fourth plan shown here, last but not least, is the high deductible health plan. I show it separately because it's a little bit of a different type of plan design. These things are designed by the IRS and called qualifying plans, because if you enroll in this type of insurance program, you get to have that health savings account, as I've mentioned before. You'll notice that the copays don't exist. They still cover the same treatments, same type of provisions for coverage, all medically necessary, no limits on them. But even though it's eligible, in the first part of your claims year, they'll discount the claims based on their contract, and they'll apply to your deductible first. So in this particular plan design that you have available to you, that deductible is $3,250. So although you're already going to be saving some money from the discounts, the first part of your claims year, if you have conditions or issues that need to be taken care of, will be $3,250. paying it from a tax-free account on a tax-free basis. So it does impact your household funds less than that number looks like, about 25% less. You pay 10% after that deductible's met. If you hit another $1,750 at 10%, you're going to reach the out-of-pocket maximum and be at 100% coverage for the rest of that plan year. And that's assuming you're using in-network providers and with medically necessary treatments. But again, they can't exclude things like they used to be able to do and put holes in these things for whatever reason. And that's part of the reason the premiums are uncontrollable. But at the same time, we're getting plans with no pre-existing limitations, no upper limits of where they will stop paying. So they are much better plans after 2013. This plan also covers wellness at 100%, just like the PPO plans. Same explanation there, but that's not left off. Your deductible does not apply to a wellness exam on this one either. Maintenance medications. The PPOs cover a good number of maintenance medications. The HSA, however, covers 14 major categories. There are over 500 drugs on the list. So if you're on a maintenance medication, which often people are, you want to look at that list, and if you see alternatives, just talk to your doctor and see if you can switch to it, or if you ever start to get on the maintenance medication by recommendation from your doctor, then I would look at the list and see if they're appropriate or if you would be acceptable or agreeable to the drugs that are on this list, because they don't cost you anything. No deductible, no cost sharing. It's a good way to do it. And a lot of major categories like diabetes and blood pressure, heart disease, things like that. So pretty common drugs on the list. Take a look at it if you want to see if you can save a little bit of money on that maintenance medication. What are the rules around HSAs? They're not for everybody. You must be in a high deductible plan only. You can't be in a traditional PPO, even if it's another plan through a spouse or another source. You cannot be participating in a full flex where you're reimbursing your medical deductible. It just takes it out of a qualified plan type design according to the IRS. You can't be enrolled in Medicare, TRICARE for Life, or even receiving VA benefits in the last 6 months to put tax-free deposits in these accounts. You can't be claimed as a dependent on somebody's tax return. So that doesn't happen a lot, but that's a preclusion from tax-free deposits into an HSA. The bank that's sponsored by CCS is HSA Bank. If you join the high deductible health plan, bank account will be automatically open for you with just a little bit of information to identify who you are. The tax-free deposits can be made out of pay or outside of pay, but you'll want to remember to deduct amounts from your income as you file your taxes in that following year, so that you take the tax-free savings out that way. If you do it payroll deduction, you're getting the tax savings as you go. So remember, if you don't spend the money in these accounts, it stays in there, rolls over, and it's a beautiful way to save tax-free dollars over time, really for retirement. So you have some money squirreled away that you haven't paid taxes on, and you probably will never if you spend it properly. Two plan components. Not to belabor this subject, but remember that it's an insurance plan that you can refer to as a catastrophic plan because it doesn't provide you with reimbursements or paying for doctors under the deductible. It discounts them, but it's not going to really feel like you're getting any worth out of it, although the discounts are pretty significant. The second is the bank account. So these are the only plans that allow people through an employer to have every expense they pay tax-free if they want. Premiums are tax-free pay. Any cost sharing that you experience can be paid by the HSA tax-free or reimbursed from there if you have to use tax dollars because of the timing of the claim. So those are the two component parts. Just good to understand that that's how it works together. Benefit of a tax-free account to self-fund the front end is helpful for people that probably don't use the plan very much in some cases and can put the money aside over time, or people that want a tax shelter that make a little bit more money than average. Those are the two people that primarily have these plans, but it makes some sense if you're not just getting the deductible at the end of the year and starting over again in January. I'd say take a look at it. So what can you spend this money on? Medical, out-of-pocket expenses, of course, deductible and the co-insurance that we talked about. You can also spend it on out-of-pocket expenses that you have when you use dental or vision plans. You do have some cost sharing, as you saw. So this tax-free dollar bank account can be used to pay those expenses tax-free. It's also used for immediate family members tax-free. Even if they're on a PPO plan with copays, you can use your debit card, Visa card to pay their copays or whatever out-of-pocket expense they have, even if they're not enrolled on your plan or even a high-deductible health plan for that matter. The maximums allowable as far as the deposits go, issued by the IRS just a month or two ago, went up quite a bit. Single coverage, 4,150, and twice that much for family. It's the maximum you can put in the bank account tax-free, but you don't have to put anything in the bank account if you don't want to. But these are the maximum amounts. If you're over age 55, you got an additional $1,000 to put in that bank account. So please be mindful, because at that age, you'll want to start squirreling away money for retirement, which is what this is really intended for initially. So let's talk about just some general things. How can you manage your costs? It's so atrocious that things are costing so much in this arena, premiums and the claims. And the deductibles have gone up, so you have to share more of it. So how can you save money? Well, make sure you're in network. I can't emphasize enough, because right now we've got a pretty big problem in America where out-of-network physicians are being scheduled, anesthesiologists are getting involved in surgeries when they're not network, and it's because providers set those things up without even paying attention to who your network is. They are not concerned about it. It's not their responsibility. And just make sure that when they're setting up a surgery, that you know who all the billers are going to be. Anybody that bills you afterwards, you want their names, and you want to look them up on the Blue Cross site. It's just very important, because the balance bill can come in at extremely high amounts depending on what the service is if an out-of-network provider is used. Maybe $3,000 or $4,000 for an anesthesiologist, but up to $100,000 for a specialist. I've seen, just in the recent months. Ask your pharmacist for lower cost alternatives. I've said this a few years in a row, but there are some, and they're not going to hesitate to give you a lower cost drug if it's a type A generic, type A match with the name brand. Might be a lot of savings there for you. I've done a lot of comparisons, and it's a big spread between newly advertised drugs than their more generic alternatives that already were on the market or soon to come. Recommend you can really look at over-the-counter medications too. Sometimes they're perfectly good over-the-counter medications, and if you have the HSA, you can buy those tax-free as well. PPO network, even more important than dental and vision, way more important. There's a lot more dollars coming in here. azblue.com is where you go. You want to make sure you find a doctor, and then you give it the zip code and some other information about who you're looking to have services from, type of physician, and it'll pull up a list within 10, 20, 30 miles of your home. So it's also important to just make sure you know how to use this, because you can't look them up if you don't know how to search out them on the site. So it's just important to get a little idea. When you're there, you want to pick the national or statewide national PPO network. That's the one you're in. All the other options wouldn't give you the right network to pick from, so it'll produce a list that's probably not as accurate as you want it to be, although it has some positions that are overlapping. But once you enter the zip code, it's going to pull a list. Tell 10 miles, 20 miles from your zip code, and it's going to pull a list accordingly. If you need help with that, we can certainly look up physicians pretty quick and easy. 2 apps to talk about Blue Cross wise. You have Blue Care Anywhere, which allows you to have virtual office visits, that you don't have to go to their doctor's office when you're ill. They can issue prescriptions there, mostly for primary care. It doesn't make sense really to have specialist care there, because it does take a more physical exam face to face. But it's convenient access is really what it is, and I have them. I recommend them because they've come in handy for me as I'm looking up urgent care as I race away from a soccer field with my daughter, or something like traveling. I've used it and gotten a prescription within 20 minutes of the virtual visit, which was only delayed about 15 minutes from the time I initially contacted them. So just think about the apps. You want to make sure you connect with Arizona's Blue Cross plan, and that can be done also through this MyBlue AZ app. You got your ID card on there. You can look at claims. You can search for providers. Most importantly, because sometimes that has to be done pretty quickly while you're heading to a facility to get treated. Both these apps are on the Apple Store and Google Play, so they should be pretty accessible to everybody. The ease enrollment process, no paper, no repeating your name and address for every application. So it's a good environment because it's a lot quicker and easier for enrollment and changes. If you don't want to make any changes, you don't have to go into ease this year. That's a passive enrollment, which means do nothing and your benefits will stay the same. If you want to change something, you do have to go into the system. If you forgot your password, we can reset it for you. If you didn't get the email, we can get it sent to you again. So you want to call us at the Reach Group if you have any issues with the enrollment system. We're on a little bit of a tight timeline, meaning that we're going to open the site as of tomorrow on the 16th, and that'll be available to those people that want to make changes as of that time. You'll either enroll or waive coverage if you do go in there, and if you don't, like I said, we're just going to roll your benefits forward to 2024. That just is the way we're going to have to do it, and so the plans are so similar, it's not going to certainly create errors in the enrollment. But you want to make sure you sign electronically and approve. You'll get a confirmation of your enrollment, so you'll know you're finished in the e-system before the site closes. So we're going to have it open for open enrollment from the 21st, which is Monday, through December 2nd, which I believe is also a Monday. Just go find the easy email that we send, click on the link, and just go through your benefits and just make sure you check dependents information, beneficiary, and then make sure you're electing the coverage that you want, especially on the short-term disability plan where it's not as easy to figure out, but just know it's going to set it really low. We had a pretty disappointed employee that had that lowest amount and didn't realize that that was the default election to start. If you have questions, you're going to call Joanna or I at the Reach Group, and you're going to ask those questions about the plans, benefits, specifics, and anything at all that you want us to try to figure out with you related to the insurance plans or the market in general. I tend to think I know everything about everything because I've been doing this 40 years, but don't know everything, I guess, is what I'll say honestly. But we certainly will try harder for you if you call us and let us know what's going on before you get engaged or have a medical treatment. That's a little bit easier than fixing it afterwards. So we look forward to serving you. Thank you for taking some time to listen to this brief presentation today. We'll talk to you soon.